Thank you for joining us on Children's Clinic. Today on Children's Clinic, in case you're just joining us and you don't know what the program is all about, well, it's a health magazine program that is how to educate wards, parents on the need to take care of children, and of course to know some health medications, and of course to know how to manage some health issues and conditions your children have. And so today again on the program, as usual, we'll be taking a look at malnutrition in children. What is malnutrition? What are the effects of malnutrition on a child? And how can you manage malnutrition in your children? Well, stay with me now as I invite Dr. Mrs. Oluwafemilayo Adeniyi, who is a gastroenterologist and nutritionist at the Lagos State University Teaching Hospital, Lagos. Thank you, Doctor, for joining us.
Thank you very much.
What is malnutrition?
Okay, malnutrition basically refers to a state where a child is not getting enough nutrients in terms of caloric intake and proteins. So in this situation, the child could have variable manifestations ranging from what we call kwashiorkor, marasmus or marasmic kwashiorkor.
Stunted growth.
Stunted growth. Yes, it can cause stunted growth. Okay. Basically, it's a condition that results from inadequate caloric intake or inadequate protein intake, and depending on which of these inadequacies is greater would determine the clinical manifestation the patient would physically come down with.
All right, doctor, let's talk about the caloric intakes of children. What are these caloric intakes, and what should the child take?
Okay, in terms of caloric intake, we expect a child to get what we call the balanced diet. Okay, in which case with every meal all the nutrients should be well represented.
Talking about protein,
carbohydrates, fats and oils, vitamins and minerals. And the proportion should be that you are having a child taking at least 60% of carbohydrates, about 30% of proteins, fats and oils should be between 10 and 20%, and the same for vitamins and minerals. So we expect every child to be getting a balanced diet, a minimum of 3 servings per day, breakfast, lunch and dinner. And with each of this breakfast, lunch and dinner, the child should get all this in the equal proportions.
Okay.
Children can also have snacks in between, but healthy snacks like fruits, oranges, bananas, watermelon and so on and so forth.
Okay, now you talk about healthy snacks. Do we have unhealthy snacks? And what are they?
Unhealthy snacks are generally all these refined foods that you have in the market, fizzy drinks, things like energy dense caloric foods, meat pies, pastries, which is very common with all our eateries. Other unhealthy snacks are also things like hot dogs, basically fizzy drinks in addition to this.
So parents should guide against this.
Yes.
Okay, now let's talk about the effects of malnourishment in children.
The effects of malnutrition is very variable and they are numerous. If a child doesn't get enough caloric, enough proteins, it could affect the development and the growth of the child. Okay, growth in that the child will become stunted, wasted and stunted, and usually they will lose a lot of weight. In terms of height, they will be stunted. In addition to this, malnutrition can also affect the brain development, especially when this occurs in the first 3 years of life. So these children will end up having low intelligent quotients, being mentally retarded. And so we encourage mothers to make sure that their children are getting well nourished or good nutrition in the first 3 years of life, because that's when you have the most rapid brain growth. And if a child becomes malnourished during this critical period, the child will have mental retardation and poor mental development. In addition to the mental development issue, children with malnutrition also would have some immune problems. They have reduced immunity, and so they are predisposed to a lot of recurrent infections, especially bacterial infections. So the effects of malnutrition it's quite varied. Yes, it's quite varied. And if it occurs in the first 3 or first 5 years of life, it can leave a permanent damage and permanent disability in many children.
Having enumerated the effects of malnourishment, now let's talk about the causes of malnourishment. Apart from not having enough nutrients on the child, what are the other general causes of malnourishment?
Okay. And malnutrition, really, we can basically categorize into two main types. We have what we call the primary malnutrition, which results from inadequate intake of calories and proteins, okay, and sometimes inadequate intake of what we call micronutrients. Micronutrients.
Now, what do you mean by micronutrients?
Micronutrients basically are vitamins and minerals,
okay,
like vitamin A, the B vitamins, folate, zinc, calcium.
Vitamins and all.
Okay, and then you also have vitamins and the minerals. Minerals are the zinc, copper, iron, and so on and so forth. So you can also have micronutrients deficiency. Okay. Then we have what we call secondary malnutrition, which is secondary to a disease in the child's body. So this doesn't have to do with intake of protein and calories now. It probably has to do with the utilization of the food that the patient takes in. The patient is not utilizing it properly, it's not being absorbed well, or there's a disease pathological disease that is making the child to fail to absorb the nutrients or is losing the nutrients. Okay, so in cases of chronic infections like tuberculosis, retroviral infection, that is HIV, you can see that the children will start to lose weight because they have a pathology in the body. Then if the child is losing a lot of nutrients, like if he has chronic diarrheal disease, it can also come down with malnutrition.
Alright, doctor, now let's talk about how to recognize a malnourished child.
In order for anyone to be able to recognize a malnourished child, you find out that these children would be wasted. And what do we mean by wasting? They will look very emaciated, they have prominent bones of the body, the zygomatic bones will be prominent, the eyes may be sunken because they will lose the fat around the eyes, their ribs are quite prominent, and they look quite ill. Okay,
They don't look healthy.
They don't look healthy.
Okay.
The hair may be brown and fluffy, sparse, you can easily pluck it. And then for a child that has kwashiorkor, in which case the patient has a severe protein deficiency, they would retain water in the body and they will look edematous. We say they have edema. Okay, and they may also have zinc changes and skin changes because of the micronutrient deficiency, especially zinc. So they may have peeling of the skin, and generally they will look very miserable and apathetic and ill.
Okay, so those are the telltale signs when you say child who looks that way.
Yes.
You begin to suspect. Okay, now how do you help a child who is malnourished?
Okay. Well, to help a child who is malnourished, actually, prevention we always say is
better than cure.
So it's better to recognize a child that is on the way or on the path of becoming malnourished.
Okay.
And that's the essence of all our well baby clinics and immunization clinics, where growth is monitored on a regular basis. So when these children come for their immunization and to these clinics, their weights and heights are recorded on what we call a growth chart.
Okay.
A growth chart. And so you can easily pick out and monitor a child who is having some form of growth faltering.
Okay.
The weight is not increasing, the height is reducing and all that, or the growth is static. You can actually pick them out in these clinics. But by the time they become malnourished and they present to you in the hospital, we tend to manage them in phases. First, you recognize the life-threatening complications that they may come in with. If they are pale, they don't have enough blood, then we have to transfuse them. If they have signs of overwhelming infection, put them on antibiotics. For those that have remarkable skin lesions, where the skin has really peeled off, then you have to take care of those skin lesions. And then usually, because they usually have low glucose body stores, so they may have what we call hypoglycemia, that is the blood glucose is low, and that can readily kill the malnourished child. So you need to do the blood glucose, recognize this if it's present and treat appropriately. Others are coming with diarrhea, maybe severely dehydrated, so you need to give them to rehydrate them appropriately. So in the first 24, 48 hours, you are dealing with these life-threatening complications.
Okay.
Once they come in. Thereafter, you now start to introduce feeds for these children. You work with your dietitian to get the appropriate
Diet for them.
So we start with low calorie diet, low protein. We don't rush these things into their system.
Because they've lost it, so they have to bombard them with it.
We don't do that.
It's a gradual
process. So we give them calories and proteins gradually. What now WHO is calling starter feed or F75.
Just like you have in chicken and all of that. So you have for human beings as well.
Yes. So this starter feed is usually a cereal-based food where you add fats and oils, you add minerals, vitamins into it. You make it quite rich. Okay. But we start at like 75 kilocalories in 100 meals, and you feed them. And then after you do this for like a week. Okay, to stabilize them. Then you step up your caloric intake and your protein intake thereafter. At the same time, you need to carry the family alongside. So we do a lot of nutrition education for the mothers, food demonstrations, and train them on how to use our own local foods to make all these diets and food that the child will need. Before the child leaves the hospital, before you describe, you must be sure the mother knows how to feed the child. It's well grounded and well educated on feeding and the malnutrition itself, and what she can do to prevent malnutrition in any other child that she has.
Okay. Now you laid emphasis on the first 3 years of the child, which is very important. I want you to go over this again.
The first 3 years of life is very critical in any child's life, and it's the period when you have the rapid growth of the child, both in terms of body growth and in terms of brain growth. So during this period, child is growing very rapidly, so there's a high need for caloric intake, for protein intake, and we ensure that the child is protected against several diseases by ensuring that he gets the appropriate immunization. Okay, and so the advocacy is mainly for in the first 6 months of life we should be exclusively breastfed, because we know that breast milk at this time will provide all that the child needs for appropriate and good growth in that first 6 months of life. After 6 months of life, then we talk about complementary feeding, weaning diets, and this should also be mothers should know how to prepare good weaning diets. Appropriate weaning diets. It must be well prepared. It must be given timely for the child to grow. Okay, so we keep educating the public and mothers on the introduction of complementary feeding or weaning diet
at the right time.
After 6 months, at 6 months of age. In these first 3 years of life, we want the children to be well nourished so that they can grow well and they can also have good brain development.
Okay, you've mentioned complications of a child who's malnourished, but let's wrap it up as we close on the show.
Okay, just to recap again.
Yes.
Complications include poor growth. Children may become wasted, may become stunted. Also, they may also have poor brain development, poor brain and growth development. So they may have children with low intelligence quotients or who are even mentally retarded. Then the other issue is about the immune status. If a child is poorly nourished, the child will have poor immunity, won't be able to fight infections and be coming down with recurrent infections.
Okay. Thank you very much, Dr. Oluwafumlayo Adeni. It's nice having you on the show.
Okay, thank you very much.
Well, in case you're just joining us, the program is called Children's Clinic, and what we just spoke with Dr. Adeni on malnutrition in children. I hope you have gained 1 or 2 things there. And the key amongst what she said is that parents should learn to feed their children well in the first 3 years of life, which is the basis and foundation of their stability. And of course, breastfeeding, she also said, is so important, and immunization is also key. Well, the program is called Children's Clinic. We'll have a break now, and when we come back, we'll wrap it up on the show. Stay with us. All right, welcome back. And the program is called Children's Clinic, and just like you heard from Dr. Oluwafemilayo Adeniyi, you've had so much, and I'm sure that you have been educated on the show today. But we'll have a break now to bring you a package on malnutrition in children. Stay.
Malnutrition erodes the potential of a human being. Its massacres are silent, away from the news cameras. Malnutrition denies a person key nutrients such as vitamins, iron, and trace elements. Because of iron deficiency, many pregnant mothers are anemic. They have less red blood cells. They will have underweight children. Less chances for a decent life. And the next generation will be poor, partly invalid, and a burden for their family.
Well, that was a package on malnutrition. I'm sure that you have gained one or two things in that package. As we move on to the next item on the show today, as we'll talk about some health news.
The World Health Organization (WHO) has created awareness on vaccine-preventable diseases that are plaguing mankind. Statistics has shown, however, that recently diseases such as pneumonia and diarrhea accounts for 29% of all under 5 deaths and result in the loss of 2 million lives each year. This is followed by other diseases such as diphtheria, measles, and polio. Several studies have shown that immunization prevents illness, disability, and death from vaccine-preventable diseases, including mumps, hepatitis B, pneumonia, tetanus, cervical cancer, measles, rubella, and diarrhea. According to the World Health Organization, immunization currently averts an estimated 2 to 3 billion deaths every year, but an estimated 21.8 million infants worldwide are still missing out on basic vaccines. 1 in 5 children are not receiving routine vaccines. In Nigeria, vaccines-preventable diseases account for 22% of infant mortality in Nigeria, and this is due to some cultural, religious beliefs. Illiteracy too plays a role in all of this, which deprives children of life-saving vaccinations made available through immunization. This exposes them to infectious diseases that cause death and deformities. Kidney failure. Millions die due to high cost of treatment. Experts say that about 3.6 million Nigerians, that is 23%, are suffering from various stages of kidney diseases in Nigeria. Kidney failure occurs when the kidneys stop working well enough for one to live without dialysis or a kidney transplant. The high cost of a treatment of kidney disease is leading to the death of many patients in the country, especially in Nigeria, with the cost of dialysis on the average amounting to 20,000 naira or 25,000 naira per section. Many a times, 75,000 naira could be spent per week, and that is being conservative. More than 2 million kidney failure patients worldwide die prematurely every year. This is because they can't afford treatment. Most of these premature deaths occur in China, India, Indonesia, Pakistan, and Nigeria, where deaths occur less than 1/4 of eligible patients receive treatment. Medical experts have revealed that more people die every day from kidney-related diseases than malaria and HIV and AIDS in Nigeria. According to a survey, kidney patients are not able to afford erythropoietin, a blood-boosting drug. A research finding has revealed that carbon emission from generators contributes majorly to the high increase of cancers in Nigeria and other countries. Cancer is about to surpass HIV and AIDS pandemic in Nigeria, as 26 females die of cervical cancer and 40 women die of cancer of the breast, including deaths from prostate cancer on a daily basis. The research papers presented during the two-day conference pertained to the applications of mathematical modeling in two areas, which include environmental protection and health, ecological risk assessment. The report, which was disclosed in Abuja in an international conference on mathematics modeling organized by the National Mathematical Center, Islamic Educational, Scientific and Cultural Organizations, ISESCO, and Commission on Science and Technology for Sustainable Development in the South, COMSAT, did reveal that fumes from generators are responsible for the high increase in cancer because they are carcinogenic. Experts recommend dietary products for healthy living. Nutrition experts has recommended dietary products as an integral component of healthy lifestyle. Making the recommendation in Lagos, the expert confirms that dairy and its products have the potential to assist the country in achieving the number 4 and 5 Millennium Developmental Goals, MDGs, and also fight against malnutrition in Nigeria across all life stages and economic groups. Regular consumption of dairy products can help tackle the issues of malnutrition, which is a growing national concern, as the consumption can increase accessibility of quality dairy nutrition. People can also have access to the opportunity of getting up to 50% of the nutrients that they require daily, which the body cannot make on its own. NIPRD to make drugs available for public use. The National Institute for Pharmaceutical Studies and Development, NIPRD, is set to make drugs available for the nation and citizens, especially in terms of drugs production and other drug-related services. This will be more efficient if adequate cost is made available, as well as constant power supply, accreditation, and maintenance of the Institute, 12 new laboratories, equipping the central laboratory facility, the Institute presence in the state and geopolitical zones based on the increasing request for services, as well as acquiring a reasonable number of research equipments and skills.
Well, that's all we'll be able to take today on Children's Clinic. And don't forget that Children's Clinic will be back again next week. And for you who are just joining us, in case you do not know what the program is all about, well, Children's Clinic is a health magazine program targeted to talking about the health needs of the children. I'm sure you will be informed watching every minute of the show. Join us again next week. My name is Jumoke Adeso. I'll be back and have a health-free week.